The next case is a lady who has had extensive dental work done, mainly in Japan. Unfortunately, either as a result of this or because she has a different problem, she now feels that her teeth don't fit together properly. In fact, she feels that she only meets on one side, and she also has a lot of pain as a result of this. Consequently, we had to examine her. We confirmed that she was indeed correct. Her teeth only did meet on one side. She has lots of crowns, bridge work and implants in place. And so I was concerned that either the dentistry had been done to an incorrect bite, which I suppose was possible, or that she had problems particularly with her jaw joints, so that the joints were unstable and that the bite position had changed because of this instability after she'd had the dentistry done. In order to make the situation more stable, we fitted her with a full coverage lower bite appliance, which she found very comfortable. We adjusted it over several visits and she found that the pain that she'd been suffering from went. She did report, and you'll see on the video, on one occasion she had a little bit of discomfort in the jaw joint, but that's not unusual. Sometimes patients can do all sorts of strange things with their jaw when they're sleeping, and that can put some strain on the joint. After having established that everything was stable, we then equilibrated her, which is a procedure where we made all the contacts on the teeth even again and gave her a anterior guided bite, which is a more effective bite for her. And then we checked it with a device called the T-scan. And at the end of all the treatment, she was very comfortable. This was 9 months ago. She's been very comfortable since, and she's much, much happier lady than she was. So as far as chewing goes and function goes, how's that been?
I'm happy. I've been happy. I can chew properly, and I can actually speak properly.
Right.
I even had a problem speaking before until I came to see you. Yes.
Can you just the radio? Go on. Yeah.
Yes. So yes, I'm happy.
Yes. Yes. And do they feel as if they're meeting evenly now?
I do think so.
Yes.
From the last adjustment, I can actually chew both sides.
Yes.
I think it's now that the left side, which was touching really hard before, touching less. Although I had a dull pain last night, but yes.
So it's just made things more easy. That's happy. Right. So we need to go down a couple. Okay, right, let me just check this. Found it last time. It's close for me. And open. And close. And squeeze. Good, and open. So, yes, bearing in mind that you're missing a tooth on the left, the force is 45% left, 55% right, and I think you've always got this sort of habit that you start to close towards the right first and then it comes towards the middle, and that's being consistent all the way through. So that's just the way that you close, so that's fine. So I'm happy with that. You've got the biggest force on the teeth that you want the force to be on, and you do get noticeable force, so that's not sort of over heavy, it's fine, I think. So, yeah. And the speed's okay. The point where things seem to be nice and stable, we've got the improvements that we wanted with the bite. You can continue to wear the appliance at night because I think it's just better, particularly bearing in mind how much dentistry you've had done. It should be a bit more protective for you. Don't worry, you don't wear it every night though.
I actually feel secure.
Yes. Yeah.
Wearing it.
Yes, it's quite common.
Sometimes I go to bed and thinking, something nothing here.
Yes.
And then I realised that I wasn't wearing it.
Right.
Okay.
Okay. But I think that that's it as far as this course of treatment is concerned.
Okay.
So.